We have the absolute pleasure of having Dr. Scott Harris with us today, and we're going to be talking about some of the anomalies that we're seeing this year with the coronavirus, the flu season, and what the winter looks like for us in Alabama. At this time, I'd like to hand it back over. And Dr. Harris, if you would introduce yourself.
Sure. Thank you very much for inviting me today. It's really a pleasure to join you, and I really do appreciate this opportunity to talk to you. My name is Scott Harris, and I'm served as State Health Officer with the Alabama Department of Public Health. So I'm just a guy from Talladega, Alabama. That's where I grew up and where my parents still live. I went to high school there. I actually went to a medical school in Birmingham. At UAB, I trained in infectious diseases there. I actually trained in internal medicine first, and then did a fellowship in infectious diseases at UAB after doing an internship and residency at Caraway Hospital. And then I went to Decatur up in North Alabama for almost 20 years. I was in private practice there and operated in originally 3 hospitals. We had 3 hospitals in our community, and eventually got down to 1, which is a story for another day. But my practice was in adult infectious diseases, and so I did a lot of HIV care. That was mostly what I did in the outpatient setting. I did a lot of work with the health department, also working with STD patients and TB patients and some other things like that, and then saw patients in the hospital as well. So about 5 years ago, I was approached about taking the job with public health. I've always really enjoyed public health. My mom was a public health nurse, actually in Talladega growing up. So I kind of hung around the health department and got my shots there when I was a kid. And so public health was a real great fit for me. It involved a lot of things I really care about. We in public health really are doing our best. We say to promote equity. We want everybody to have a fair chance. That's what public health's about. It's about promoting health equity. And so the situations that you're born into and situations you encounter in life shouldn't determine your outcome in life. You ought to be free to achieve anything that you can possibly achieve in life. And public health just plays one role in that, just like our educational system and our mental health system and so many other supporting systems do. But public health is a great role for me. So I was fortunate to be asked to be in this role about 3 years ago, a little over 3 years ago, as state health officer. Before that, I was working as a district health officer up in North Alabama. And so I had no idea COVID was ever going to be a thing. We didn't expect that. And I'm sure no one who's watching today had any idea about that either. And so that's really consumed our lives, as you can imagine, for about the last 8 or 9 months. But anyway, I'm very glad to be here with you, and be glad to talk about COVID or about anything else in public health that you all would like to talk about.
We appreciate that. And before we kind of jump into some of the specifics on coronavirus, if you could just give us an overall arc of what exactly your title and your position does in the state of Alabama.
Sure. So I'm called the state health officer, and under Alabama law, the person who runs the state health department has to be a physician, and so I'm hired by the state board of health. I actually have a functioning board called the State Committee of Public Health. That's about 16 people. A lot of them are physicians as well and affiliated with a medical association. But we also have other people on the board, including at various times we have pharmacists or nurses or hospital administrators, veterinarians, sanitation engineers. There are a lot of other health professionals that also serve as my board member. And so that's the people I work for, and that's who I report to every day. Public health in Alabama has a lot of responsibilities. We have a lot of regulatory responsibilities that we're given by law. So we're the people who inspect restaurants, and we're the people that go to school cafeterias and make sure they're safe and clean. We are responsible for people who have septic tanks. If you live in a rural area and don't have your house on normal municipal sewer, you have to have a septic tank, and we're the folks who are in charge of doing that. We're the agency in the state that investigates dog bites. So, we have to make sure people aren't exposed to rabies, for example, or things like that. We're, believe it or not, the agency that responds to nuclear disasters. So we've never had one, but we've had some worried situations, and that comes out of the history of the health department being responsible for x-rays way back when. And so we have a lot of nuclear and x-ray specialists who work for us. And so we work with Alabama's 2 nuclear power plants on emergency preparedness and preparing for things like that. So those are all part of our regulatory role. But the part that I would have to say enjoy the most, or the part that we really get up in the morning for, just has to do with promoting public health, finding ways to keep people safe and healthy. You know, Alabama is a state that has a lot of chronic disease. Unfortunately, we have a lot of people here who smoke. We have a lot of people here who aren't that active, and that puts them at risk for heart disease and diabetes and other diseases of sedentary lifestyles. We don't always eat the best foods in Alabama, and I'm very guilty of that myself because I grew up in Alabama. We like to eat what we like to eat here. But there are a lot of issues that make our state not really a very healthy one compared to some other states. You know, it's hot in Alabama. People don't like to get outside and exercise. You know, we also are a pretty rural state. People are spread out. So we don't walk to the grocery store or walk to church or walk to work in most cases. You just get in the car and drive for a while, you know, to do those kinds of things. And that, you know, after decades of that is not so good for your health. So those are all things that are real important to us and part of what we do here at ADPH.
What would you say is the one biggest thing that you would recommend for people in Alabama to really take care of their health?
You know, that's a really big, important question. And it's a really simple answer. There are 2 or 3 or 4 really concrete things that would eliminate so many problems. And it involves don't smoke, wear your seatbelt, eat healthy foods, and try to get out and exercise. And that would take care of so many problems in our state. We would be, instead of being 47th or 48th and everything, we'd be a top 10 state if people would not smoke, wear their seatbelts, watch what they eat, and try to exercise. Those are the most important things.
And it's amazing how those small things done on a daily can have a big impact in the future, even on finances and the cost of Medicare and Medicaid, those types of things.
Listen, that's absolutely true. You know, we care about people's health because we care about people, and that's important. But part of our job too is to make these judgments about what's cost effective. And you know, you hate to distill health down into a return on investment or whatever, but we're a government agency. We spend people's tax dollars, and we have to be responsible for doing that in the right way. And so we spend a lot of time looking at ways to get a return on our investment. You know, if we're going to bother to start a program, we want to make sure that there's value in it. And the programs that are really most cost effective are those things that keep people out of the hospital. People, when they go to the hospital, medical care gets really expensive really fast. And, you know, sometimes your insurance company covers that, although we all do when all our premiums go up. But in a lot of cases, people don't have insurance. And so the taxpayer in general has to cover that, or else your hospital goes out of business. And so for all of us, we want to keep people healthy enough so that they don't go to the hospital. And believe it or not, it's those same 4 simple things I mentioned just a minute ago. You keep people out of the hospital by preventing those chronic diseases and preventing, you know, things like accidents that could have been prevented with seatbelts, those kind of things.
Yeah. Kind of a side note here. Did you ever watch the show Chernobyl?
Oh, yeah, right.
So I watched that with the nuclear meltdown there. And then I immediately went online and I said, where is the closest nuclear power plant to me? And what do I do if something happens?
Yeah, that's a great thing to know. So we have 2 in Alabama that are functioning. We actually have a 3rd one that never has been active, the Bella Forge plant up in Jackson County. But, you know, we have 1 in Limestone County. We have 1 down in Houston County. And it's good to know what's in your neighborhood. You know, I used to live near the one in Limestone County. And so every year you get a calendar sent from the nuclear power plant just as a little gift because you live there. But it has your emergency evacuation plan on there so that, you know, you always know which direction to run in case there's an issue.
Here in Birmingham, I live in McCalla. I go south. I go to Tuscaloosa.
Oh, yeah, right. That just go away, whichever way it is.
Yeah. Oh, that's funny. So your background is a lot in infectious disease, and that is becoming very relevant right now with the coronavirus. And I kind of want to talk, we hear COVID-19 coronavirus. What exactly is the coronavirus?
Coronaviruses are a whole class of viruses that we've all had before and that have been around and been recognized for a long time. Coronaviruses are one of the most common causes of the common cold. You know, and so anytime you've ever had a cold, anytime one of your children has had a cold, it could be lots of different viruses, but many times that will be a coronavirus. And so we've been exposed to them, and there are actually coronavirus tests that have been around for years that have been used to diagnose these sorts of things. There are one family of coronaviruses that seem to be particularly dangerous, though, and we've had two examples of that before we've seen the most recent thing with COVID. So about 15 to 20 years ago, there was an outbreak of a disease called SARS, SARS, which stands for Severe Acute Respiratory Syndrome. That was a coronavirus. And then a few years after that, in about 2006 or 7, there was one called MERS, or Middle Eastern Respiratory Syndrome. And most people have probably heard of SARS and MERS. Those showed up kind of without warning, caused pretty large outbreaks, caused a lot of disease and death, actually. In the case of SARS, it actually has disappeared. It's gone away. We've never seen it again. There was such great infection control done at the time that it just sort of snuffed itself out. And as far as we know, it's not around. MERS, on the other hand, still crops up occasionally in the Middle East, typically, but we worry about that sometimes when we see travelers from the Middle East that have a really severe respiratory problem. So COVID-19 is just the latest example of one of this family of coronaviruses. It's a virus, that as far as we know, never showed up until November or December of last year around Wuhan, China, in Hubei province in China. I think the very first person who's been identified probably got sick in late November, is what we think, the best we know. Now, the disease may have been around before, but we haven't seen it. And one thing we know about all viruses, and especially coronaviruses, is they tend to hop from people to animals quite a bit, and they can mutate going back and forth. And so it's not unusual for a brand new virus to appear because people were exposed to some kind of animal. And if you remember, the original outbreak in Wuhan, China, was around a live market where people bought live animals that they would take home and slaughter and eat. And so we don't know for sure that that's where COVID-19 appeared, but it certainly makes sense and is consistent with what we know about other diseases.
Why is there, I feel like there's such a big difference with the coronavirus now and SARS and MERS? Lockdowns going on, the hype about it. What's the major thing there?
Well, there's several things, and a lot of those just have to do with when they occurred and where they occurred. When SARS showed up, if you were around and remember SARS, almost every case of SARS eventually got tracked through contact tracing back to one guy who was staying in one hotel in Taiwan or Hong Kong. No, Taiwan. So, there was really like a point source. There was like one guy who was patient zero. And everybody who got exposed to SARS was connected to that person or connected to somebody who was connected to that person. And so they did a terrific job with contact tracing. They were able to isolate people in advance before they could get sick and spread it to other people. There was a terrible outbreak, you may remember, that ended up around Toronto in Canada. Many people in the hospital were infected there. But again, that was tracked eventually back to this one case that came from China. So in that case, it was just such a quick response that they were able to sort of snuff that out. With MERS, on the other hand, the one saving thing about MERS is that it occurred in parts of the world in the Middle East where people didn't travel widely or easily. And so again, it was a little bit easier for people to get in and sort of take appropriate interventions and try to quarantine people and get it taken care of before it spread. It's never gone away, and we do still see outbreaks, but they tend to still be in the Middle East, particularly in Saudi Arabia, places like Jordan, Syria, those parts of the Middle East. The only time they're an issue here is when someone travels. And what has happened in the last 20 to 25 years since SARS began is that people are traveling more than ever. And, up until this outbreak, through last year, there were more than 1 billion people who crossed international borders. So in 2019, more than 1 billion people went from one country to another. So you can see how easy it is for a disease to get transmitted. Mm-hmm. When our government shut down travel from China at the end of January, that was done on January 31st. And until that time, there were about 22,000 arrivals every day in this country just from China. At the time of the outbreak in South Korea, which was a few weeks after that, there were around 6,000 or 7,000 people who traveled to this country every single day from South Korea. And, some of those are South Koreans, some of those are Americans who are, business travelers or whatever. But the point is, you can see hundreds and hundreds of thousands of people every day coming into this country. So you only need one sick person in one place, and then suddenly you have the ability for it to grow out of control.
You think it seems like we're going to have these pretty regularly every 5, 10, 20 years. You think we should act a little bit quicker in banning travel next time?
Well, I hope so. I don't think banning travel is the only thing that can be done, but there's certainly times when that's appropriate. One of the best comments I've heard over the past several months is that the most surprising thing about the pandemic is that people are surprised that we had a pandemic, because these things just happen over and over with regularity, and they have throughout human history. And so we know we're going to get some more at some point. So I think what the lesson to be learned is not only to consider shutting down travel when you need to do that, but it's to make sure your a health system infrastructure is in place, that you have people prepared to investigate these cases and identify them. You have people ready to develop testing capability and get it deployed. You have people ready to start working on a vaccine right away when you have a brand new disease like this that no one's seen before. All those are things that we can easily be prepared for if we're willing to put the time and resources into it.
I was talking with somebody recently, and they were saying, the coronavirus is definitely deadly, but we kind of got lucky that it's not more deadly like an Ebola. And this is kind of a check for us.
Yeah, that's exactly right. So right now in Alabama, we've unfortunately lost more than 3,000 people to this disease. What that works out to, there's about 220,000 cases. It's about 1.5% of people who get this disease die. It's a very small number of children. We have lost a few children, unfortunately, but it's a very, very small number. But for people who are seniors, it's significant. And, if you're over 75 years old and you get infected with this disease, there's about a 1 in 5 or 1 in 6 chance you're not going to survive. So it depends on who gets infected. But I'll say that in the case of SARS that I mentioned earlier, that disease had about a 10% mortality. So almost 10 times what we're seeing now with COVID. And in the case of MERS, that has about a 30% mortality. So 30 times what we're seeing with COVID. Yeah. You mentioned Ebola. Ebola has around a 70% mortality. So it could be worse. You're absolutely right.
And I say Ebola because of the movie Outbreak with Dustin Hoffman. Yeah. It's a great movie.
Yeah, it is a great movie. And, we used to think that was just Hollywood entertainment, and it's gotten to be a lot more real. Yeah. Now that we see what's going on.
Now, you mentioned, the death rates there. How exactly does the coronavirus affect the body? How does it attack the body?
So what coronaviruses do is they enter through your respiratory tract. They enter usually as a droplet that's suspended in air that you inhale. Although it's certainly possible you could ingest it, it could be on a surface and you could get it into your mouth or nose. But once it gets into your respiratory tract, it colonizes your cells and starts reproducing itself. The way viruses work is they go into a cell, they change your machinery inside the cell and start making copies of itself. So you might inhale a few viruses, but then within minutes or hours, you have billions of viruses in your body because that's how the virus works. Then what it produces is an inflammatory response. Your body's immune system recognizes this virus as being an invader, and it starts attacking it. And it seems that immune response has a lot to do with what produces our symptoms. All of us have probably heard of things that are called autoimmune diseases where your immune system gets overly active. Well, that has a lot to do with what we actually see as the problems with this disease. People have trouble breathing. It causes damage to heart muscles and to other muscles. It produces neurologic syndrome, so it affects the brain and spinal cord in a way, and a lot of other things that we probably just haven't even identified yet.
Yeah. And how is Alabama faring as opposed to other states?
We are okay right now compared to where we were in July and August, but I think we're concerned that we're not headed the right direction. Back in the summer, if you remember, our hospitals were almost full. We were getting 1,000 or sometimes a couple of thousand new cases a day. The percentage of people who were positive when we did the test was around 16 or 17% of all tests, which is very high. And we were in the top 4 or 5 in the country in terms of how poorly we were doing. What happened then is really there's only been one change, that Governor Ivey put in a mask mandate requiring people, if they could, to wear a mask. And that's the one single thing that's happened since July. And that's when our numbers began to improve about 2 weeks after that happened. So we've been plateaued. We've been kind of in the middle of the country in terms of new cases. As of this morning, I think we're number 28 out of 50, which is nice, or 51 counting DC. So that's a lot better than being number 2 where we were at one point. And yet at the same time, we do see numbers going in the wrong direction right now. And, we're seeing our hospitalizations creep back up again, not where they were yet in July, but they're going the wrong way. We're seeing our daily new case numbers go up as well. So we have some concern about that.
Why do you think that's happening now?
It's hard to put a finger on it. Back in the summer, we were able to identify a lot of outbreaks, and we said, this happened in this church, at this church event, or this happened at this sporting event, or this happened in this workplace. And we still see some of that, with nursing homes still, for example. But most of the time, we're not able to put our finger on it. And so I think the answer to your question is, it's just people getting together and doing normal social things that people like to do. You're going to people's house to eat lunch after church, or you're having a cookout in your backyard, or people are coming over to watch the football game. It's normal activity that we all have always done and like to do. But I think people aren't being as careful as they should be.
I'd like to touch a little bit on the, you mentioned nursing homes there. What would you say to caregivers and people that take care of individuals that have a disability or the elderly that are in these homes?
Yeah, I will say, first of all, the nursing homes have been great partners with us. They have done everything we have ever asked. They have really worked hard with us to make sure that they're protecting the folks who stay there. And we're really grateful for the work that they've done on that. People who are in nursing homes, or people that are in other kinds of congregate environments, they are at risk for serious outcome. If they have chronic health problems, or in the case of nursing homes, if they're older people, those folks are the ones who are going to not do well if they get infected. And so our priority is to make sure we're protecting those folks. But I will say those folks in those homes aren't the ones out putting themselves at risk. I mean, they're staying at home. They're not going to the grocery store, and they're not going to the ball game or the movie theater. And so, and that's obvious when I say that, but what I mean is the reason that our residents are at risk is because of the people who do come in and out, people who work there, people who are family members, just vendors, or, folks who are coming to do the normal kind of business that you have in a facility like that. So those are the folks that we really are trying to concentrate on to make sure that they are safe and that they don't run some risk of infecting residents, in our facilities. So most of nursing homes, for example, now are doing testing on just about everyone who comes in and out of the facility. By law, they're not required, but they can't require family members to be tested, but they strongly encourage them to. And I also would strongly encourage someone who's going to visit their loved one, just get yourself tested. These are little 5-minute tests now that you can do once a week or every couple of weeks. You don't have to do it every single visit, but if you did it a couple of times a month, you're much more likely to figure out that you might be exposed or infected. I want to remind everybody watching that about a third of people who have COVID-19 don't feel sick, and yet we know that they can expose other people. So getting tested a few times a month when you go to visit a loved one is a really good way to make sure that we're keeping people safe.
That's a great idea. People getting together over Thanksgiving or going to see someone that's elderly, take a test a few days before.
Yeah, that's exactly right. And I'm glad you mentioned Thanksgiving, because holidays, really do concern us. We want people to enjoy being with their loved ones, but if it's at all possible, 2020 may not be the year that you have a big gathering with your family. It's been a terrible year anyway. Let's just throw it out and start over.
We don't have to worry about the politics at the dinner table this year.
Yeah, that's right. Yeah, that's a great point. I can tell you, my family, we're not going to have Thanksgiving together. We talked about it, but my parents are in their 80s. They live in Talladega, where I grew up. We've seen them a few times in the past few months. Once the stay-at-home order was lifted, we go and check on them, but we do it safely, and we wear masks and we stay apart from them. Haven't got to hug my mom since probably February, before all this started. And so that's the concern about holidays. We have all this pent-up frustration and anxiety and loneliness, and we're desperate to see people, and I feel the same way. But please, let me ask everyone who's watching, please don't put older folks at risk, or people that have disabilities or chronic health problems or something else that puts them at higher risk for disease. this is not the time to do that. If you're going to get together, think about ways to do it safely. You mentioned getting tested before you go. I think that's a great idea. I would say just trying to sort of self-isolate for a week or so before you get together, just so that you minimize the risk that you could pick something up and take it, to be with your family. When you have a gathering, if you are going to have a Thanksgiving meal, can you do it outside? Does the weather let you do that? Because we know outside's safer than inside. Can you make it just a short time as opposed to, 10 people in the same house for 3 straight days? Maybe you just have a meal for an hour or two, if it's possible to do that, and minimize the amount of time. Can you even wear masks? I mean, obviously you can't when you're eating and drinking, but there may be other times when you're together when you can wear a mask, and we know that masks prevent disease transmission. So I would just ask people to think about all those things, those possibilities, and even if you're not going to cancel Thanksgiving, there's definitely ways you can do it more safely.
Mm-hmm. That is great right there. Now, when we talk about, canceling Thanksgiving, I always hear like, well, when are we going to get this vaccine? And then it'll be over.
Yeah, the vaccine's coming. And I think that's part of the message we're trying to get out now is we've had so many people work so hard to cooperate with everything we've asked, and we don't want to blow it now when we're this close. I mean, we're almost there. So the best information we have from our federal partners is that we ought to have the first vaccine product available in mid-December. Now, we're not going to have a lot of it. The amount's going to be limited. And what they have asked us to do is begin by prioritizing healthcare workers. So people who work in nursing homes or work in those type of facilities, or people who work in hospitals, those are the people that are going to be first in line. And it's because we want to keep those people healthy as a way of preserving our healthcare infrastructure to take care of the rest of us if we need to end up there. But right behind that group of healthcare workers and first responder people, we're going to prioritize those people that have certain chronic health problems or certain health issues, and also our seniors, and especially those people who have those conditions who are in congregate facilities, who are in a home, for example, because we know how easy it is for disease to spread. We think we'll have the first vaccine in mid-December. We think the second one is going to be out there 2 or 3 or 4 weeks, maybe after the first one. So we'll have a lot more vaccine by January, certainly by February. At some point, we're going to have probably as many as 6 different vaccines out on the market all at the same time. I would just emphasize that, the day you hear the vaccine's out, that's not the day to throw in the towel and stop being safe. It's going to take a long time till we get enough people vaccinated to keep everybody protected. So we're still going to be asking people, please wear your mask. Please stay home if you're sick. Please maintain a 6-foot distance when you go out, even after the vaccine comes out for a while.
You said there's going to take some time there. How long do you think that is?
Well, our best guideline is that we'll get, as I said, we'll have our first vaccine in mid-December. We'll have our second one probably in January, maybe February. By March or April, we ought to have enough to take care of those groups that I was talking about our sort of phase 1 groups, all of our healthcare workers and the people that are in these congregate facilities. And at that point, we'll start spreading that out more broadly to any adult anywhere that's over 65, that has certain chronic health problems, or anyone who kind of works in sort of a critical infrastructure kind of job, which is a big, long list. And frankly, as most of us, most people have some connection to that. In order to have vaccine for anybody who wants it any time, that's probably going to be June or July. That's what we think. The federal government's plan is to try to have over 300 million doses out for Americans by April 1st. I think we realize that's not likely to happen, but maybe by June 1st, we'll get there.
Now, is this something like the flu vaccine that you're going to have to get every year?
I wish I knew the answer, and we don't know. There have been other vaccines that have been created for other types of coronaviruses in the past, long before COVID happened. And in most cases, immunity doesn't last a long time, and you do have to get revaccinated. But the truth is, this is a brand new vaccine. It's even a new type of technology that's being used to make vaccines that we haven't used before. And so we just don't know the answer to that yet. I will tell you that almost all the vaccines, except for one we know of, are going to require 2 shots right off the bat. So separated by either 3 weeks or 4 weeks.
And what will it be like getting your vaccine? Are you going to go to the local pharmacy, or how does that?
Yeah, eventually it'll be anywhere you would go to get a shot, So for healthcare workers, for example, we're going to make sure vaccine goes to those people who employ healthcare workers. So it's going to go to hospitals and nursing homes and clinics in places like that. Excuse me.
Yep.
But by the time we're ready to get it out more broadly to people, it'll go to any type of clinic or doctor's office. Pharmacies will have it. We've actually talked to dental offices who don't normally give shots, but have the capability to do that. We've talked to a lot of other places. Public health will be doing those. We expect to have sort of big drive-in clinics like we do sometimes with flu shots, sort of mass immunization clinics. So we'll have it everywhere we can get it to go.
Very nice. We have someone, viewer, ask a question. Max Keats say, how do you address the people's fears about being the first to take the vaccine?
Listen, that is a great question. That is the right question to ask. And it's the question we've been asking for months. So what I will tell you is that I was skeptical myself. Back during election season, campaign season, there's all these questions about politics and are they rushing this through and can we believe what people are saying? Listen, I had exactly the same questions. So we have spent a lot of time working with our federal partners and with others to understand the process. And I am confident that they are doing it the right way. I believe that they will give us all the information that FDA is expected to see in the next couple of weeks. And I think that whatever FDA says, I will believe them. There is in America, we have an independent body of medical experts and scientists that also give approval to all vaccines. That's called the ACIP, Advisory Committee on Immunization Practices. These are not federal workers or employees, or they don't work for drug companies or manufacturers. They're just independent physicians and researchers and medical scientists who volunteer to do this job. And we've had some people from UAB, for example, who've been part of that in the past. It's a lot of public health people. Their job is to look at scientific evidence and make a recommendation. I know some of them personally, and I can tell you they're not working for anybody except the truth. They're working to give us the right answer. So it may turn out, that ACIP and FDA say, this vaccine's no good. I don't know what they're going to say, but I do know that whatever they say, I'm confident that it'll be the truth. And if they say the vaccine is safe and effective, then I'm going to take it myself.
Yeah, me too. I'm really happy. I didn't know ACIP existed. That is a great committee there.
Yeah. All vaccines approved in America have to be approved by ACIP, and it's been that way for many years.
I like that there's no attachment from the people that are doing. They're basically volunteering.
Yeah, that's exactly right. One of my counterpart in the state of Arkansas, who has my job, is actually the chair of ACIP at the moment, and he said getting vetted to be on that committee, was like incredible. It was like they do all these interviews and they make you document, who pays you what and where your money comes from, and it's just to preserve the integrity of that, so that you don't have somebody there who has a financial interest in it or subject to political pressure or anything like that.
Yeah. As we get kind of closer to the end here, I'd like to talk a little bit. I play ice hockey in Pelham outside of Birmingham. We just shut down for 2 weeks.
Oh, wow.
Do you think more of this is going to happen with the schools?
Yeah. Every part of society is a little bit different. Some states are starting to shut down again. I have not heard our governor talk about doing that. I don't know if that's likely to happen. I don't think it's likely to happen, but I think we want to give people around the state the information they need to make the right decisions about that. All schools, independently in each district have the ability to do that if they need to do that. Certainly businesses do that from time to time. I know somebody, I have a good friend who works at a place that just closed their business for a couple of weeks because of an outbreak in the workplace. So I think we're going to continue to see that. I don't have any indication that the state's going to mandate that, but I think we're going to continue to see outbreaks.
Yeah. And hopefully with the timeline you said, everybody's got a vaccine by June, July, and August, we should be good to go.
Yeah, I think so. I think this time next year, this will be in the rearview mirror mostly, as long as we get people accepting of the vaccine.
Yeah. What are some things that we haven't talked about that you think are pertinent to the disability community and the family members?
Yeah, I would just say, please remember that there's a lot of these recommendations that we have that seem a little bit abstract, but they're really concrete things that you can do every day. And they're actually the most important things you can do. I mean, we still don't have a vaccine out yet. We don't have highly effective treatment yet. The most important thing we can do is prevent people from getting infected. You all have the power to do that. I mean, you are the ones who can make the choices every day to keep yourself and keep your loved ones safe. And that just means staying home when you can. When you go out, wear a mask, stay 6 feet away from other people, and do your best to protect those people who have chronic illnesses or who have other reasons that they're going to be at risk. It's hard to do that. It's hard to make those decisions every single day, time after time after time. But you have the power to do that. And so I just hope people can remember that.
Yeah. Use the Zoom. I'm a very outgoing person. I like seeing my family and being around them. And it's hurt because I haven't been able to see a lot of my family in the past, 8 months. So we're almost there. We got to stick it out together.
Almost there. Almost there.
What are some upcoming events or live Zoom meetings or anything that you think the public should tune into?
We are trying to do regular information updates for the public just to keep them informed about what we're doing. We're going to do a live press conference this coming Monday at 11 o'clock. That'll be streamed around the state, but it's not a big announcement, but it's just informational. And we're just trying to encourage people to do things that are safe, to give updates on the vaccine, to give updates on testing programs or other kinds of things. I would also remind people, if you have an opportunity, go to alabamapublichealth.gov, and just look at the many different dashboards that we have there that show you what's going on in your community, what's going on in your local school system, what your hospital numbers look like. There's a lot of great information there that shows how your county compares risk-wise to other counties in the state. And those are things that I hope people will just make an effort to be familiar with, and so that you know what's going on around you.
Yeah, I'm going to go ahead and put that link in the chat. And is there a link for the stream on Monday, or is there a Facebook page you'd recommend going to?
Alex, I don't know off the top of my head, but I will get that for you so you can provide it for people. I just don't have that available right now.
Okay, perfect. Well, at this point, I'd like to conclude our broadcast today, and I'd like to thank you on behalf of the community for coming here and sharing your knowledge. And I'd like to say thank you for the work that you do.
Well, thank you. Thank you very much. It's my pleasure. None of us expected to be here, but we're all trying to do our best. And I do have to say this. I'm just one guy at Public Health. Public Health has about 2,500 people who are just doing an incredible job. Nobody goes into this job because they want to get rich or get famous. And they certainly don't go into it because they like people being mad at them, which is what happens a lot. But I work with some really tremendous people who are doing a wonderful job. And on behalf of all of them, I just say thank you for letting me be here.
We have another person in chat. Holly Cawthorn says, thank you for your dedication and diligence in your mission. It does not go unnoticed or unappreciated. And once again, Max, thank you, Dr. Harris.
Well, thank you. Thank you very much. I sincerely appreciate that.
And so we'll keep tuning in to new information as it comes out. And hopefully, like you said, this will be in the rearview mirror in about a year.
Yep. I'm looking forward to that.
Well, Dr. Harris, once again, thank you very much. And I'm going to go ahead and end the broadcast.
Okay. Thank you. Thanks for having me.
Bye.